Nearly a month. That's how long one man says he waited for contact tracers to reach out to his family after his son tested positive for COVID-19. Fox 24's Lauren Craycall spoke to the father about his frustrations and asked the ADH, what's the holdup?
At the beginning of September, we introduced you to Michael Cummings. His son Jude was one of the first positive student COVID-19 cases reported at Fayetteville Public Schools.
We had quarantined our family for the 14-day period to avoid spreading it, and luckily none of us got sick.
Jude's recovered from the coronavirus, but the Cummings family saw firsthand what they call a problem with the state's contact tracing response.
They didn't even realize the date of diagnosis. They just knew that it was a recent case in Arkansas.
Michael says he didn't hear from the Arkansas Department of Health until well after Jude's quarantine period ended.
And they called and they said all the right things, but it was 3.5 weeks too late.
ADH Acting Chief Medical Officer Dr. Bala says with the uptick in daily coronavirus cases, tracking positive cases has been a challenge.
This is not a time to give up in the middle of the pandemic. We need to press on.
Dr. Bala acknowledged there's sometimes a lag in follow-up, but says the ADH is doing much better than it previously had been.
You're right. I mean, the truth is we cannot sugarcoat it, that delays are always not good. I think there are lessons learned from these missed opportunities.
Until then, Michael has this advice for you.
Don't wait on that phone call from the state. I'm sure they're doing what they can within some budgetary constraints, but we as citizens, we can't rely on them.
The state currently has 787 contact tracers. According to the ADH, as of now, there's no plans to hire more. Reporting in Rogers, Lauren Craycall, Fox 24 News.
Lauren, thank you for that report. Well, as the number